Have you been told that you have fibroids, or you know of someone who has, or you are skeptical whether you do or not? You are not alone. In this video, I will be sharing with you certain tips that will help you identify and also help you, advise rightly someone who may be close to you. So if you are a male, don't feel this video is not for you. The facts I will be answering here, frequently answered asked questions, would also help you get to know more about fibroids and how it affects ladies and what to be done, how to prevent it, and so on. So first, what are fibroids? Fibroids are non-cancerous growths in the uterine walls of a woman. It's either on it or inside. So sometimes it can be hanging outside like a pendulum, while some it's inside and can only be seen through a scan. So fibroids are most times mostly not cancerous. Let's take note of that, because people fear, is it cancer? No, most fibroids are usually benign, they are not cancerous. So next I'll be answering is still on fibroids. We have the symptoms. How do I know I have fibroids? What are the things that can be a tell sign that fibroids are present? First is heavy and prolonged period. So if you usually have very heavy flow, like you change pads 4, 5, 6 in a day, then and the rate at which you are changing it, even when you delay slightly, you get stained, your period is just like messing you up. It's advisable that you visit the hospital and check. It may be, it may not be also, but it is good to rule it out that is not fibroid. The next could be lower back pain. You complain lower back pain, and then you also complain pelvic pain. That can also be a sign of fibroids. Frequent urination. Now you wonder, how is it connected? Some people, when they experience frequent urination, they begin to feel, maybe I have sugar, my blood sugar is high. Sometimes it may be not be so, it may be fibroids. So frequent urination, now why it is so is that the fibroids, if it is large in size, then look at what happens. It presses on the bladder. Now the bladder is supposed to be widely opened like this to receive enough urine before it signals the brain that it's full for you to go and empty. So but now it's just like a pressed balloon. The fibroid presses on it, shrinking the size, so little urine enters into it, and you feel full. So it makes the person frequently go to use the restroom. And then another one is difficulty getting pregnant or complications during pregnancy. Fibroids can be a leading cause. Most people, after delay, they wonder, what's going on. They go for a check, they see it's fibroids. Sometimes after treatment they conceive, so it means the fibroid has been hindering, because normally a fertilized egg should implant on the walls of the uterus. Now fibroids are growing there, how would it be able to implant? So those are the things. Now the causes of fibroids, well, they are not so known. Causes of fibroids are not so known. So but there are some risk factors that exposes certain females to fibroids. Now, if you started seeing your period early, it exposes you like a risk factor. If you have it in your family, your mother, grandmother suffered it, is also a risk factor. Then why it is most common these days, most women are coming down with fibroids, is because of the fluctuation of the estrogen hormones. The estrogen hormones helps in conception and other menstrual cycle regulation. So that fluctuation leads to it. That's why most times when women get to menopause, where estrogen is no longer produced, they hardly have such problems. It's just like they've passed the stage for fibroids troubles. But nonetheless, we are still on the good note to how can you diagnose fibroids. Now fibroids, usually they use an ultrasound scan. An ultrasound scan perfectly can diagnose fibroids. Remember I said it's non-cancerous mostly, so an ultrasound just tries to tell you the location where the fibroids is, it points them, and then it also helps the sonographer can be able to detect, okay, This is the size. They use a dimension to get the size, how large it is, how many too. They can get to know, okay, it's multiple in multiple locations and the rest. This will also help the surgeon for further treatment. So in treating fibroids, most times when it is asymptomatic, that is, it is not showing any signs that is affecting normal life or day-to-day living. Most times it is usually, it just stays unnoticed. Most women may have suffer fibroids and may not know in their lifetime. Yes, because it never showed a symptom. Some of them only get to know they have fibroids when maybe they just decide to do a scan, maybe a routine scan, and then they just, in the process of routine scan, they just tell them, okay, they have fibroid. But since it's not affecting them, then there's no issue. They'll just be on a watchful monitoring. And then once, most times treatment commences when the signs begins to show off, like heavy bleeding and so on. So the first and foremost is the drug. But the drug, I must tell you from my research, I discovered that the drug is not meant to be a lifetime something that you'll be taking. So if anyone told you that, they were not telling you the right thing. The drug originally was designed to shrink the fibroids so that over time the fibroids will be easily removed through surgery, and not to shrink it and it dies off. No, don't take that. That's not right. So it is meant to shrink it, then subsequently do a surgery. Well, you know, once you shrink it, it's easier to remove than when it's still very large, because people fear fibroid surgery due to excessive bleeding. And you know, excessive bleeding can be a very serious condition that they start running up and down, give us 5 pints of blood, 6 pints, and it's like, see, the person's life is at risk. So you seeing that happen to someone close to you, you'll now be scared. So will I go to that, through that surgery? Will I come out alive? And so on. So that's the fear. So the drug now is an advanced technology that helps to shrink it. Shrinking it makes it easier and reduces the amount of blood loss during the surgery. So that's for the shrinking. Other aspects is the surgery is also there to remove it. Then, so if you are wondering, at what point do I need to go to the hospital? I believe the signs, 3 cardinal signs I've mentioned: heavy bleeding, and not just heavy. That's heavy in the sense that you're using 4 to 5 pads a day and it's getting full. Then it's high time you see the doctor, because you are losing so much blood than normal. Secondly, prolonged periods. When your periods are now getting to 8, 10, 15 days, it's no longer normal. You need to see the doctor immediately. Then pain. Of course, I believe you can't manage pain. And you are, if the someone nearby you just only saying, oh, this pain should be from stress. If it is continuous, it's no longer stress. It's best to see the doctor. Lower back pain, pelvic pain, just see the doctor. Or maybe they told you it was infection, you've treated, but the pain is still there. See the doctor. So these are tell signs that you need to see. So I'll be summarizing this. If you really like what you have watched, please like this video, share it to someone who needs to know about this, and also subscribe to this channel. We share health tips on this channel for a healthier you, because I believe prevention is better than cure. So next I would be sharing some other facts, but you need to stick around. Turn on the notification icon so that you can, you know, be followed up on what is going on. If you have other questions that were not really touched here, and maybe some other thoughts on your mind, you can drop them in the comment box. I will reply to them as soon as it gets to me. Fibroids are mostly common in these days. It's not a death sentence, it's not cancerous, and of course it is manageable, it is treatable, and you will live a normal life. Thank you for watching.